For lipid lowering and diabetes, it's a bit of a complex story. There's a couple factors to take into account. One is that patients with diabetes will be at increased risk of major adverse cardiovascular events, and so there's the potential for even greater benefit in that group. They do need a robust risk reduction because they are at that higher risk. Conversely, for patients without diabetes, there's been concern for statins causing diabetes, and thus there's been a little bit of tension about how aggressively one should lower lipids in patients with diabetes and those without diabetes. So FOURIER was a randomized, double-blind, placebo-controlled trial evaluating evolocumab, a PCSK9 inhibitor. We enrolled over 27,000 patients with established cardiovascular disease, either prior MI, prior stroke, or PAD. As I said, randomized to evolocumab or placebo and followed for about 2.2 years on average. The primary endpoint was a clinical composite of cardiovascular death, MI, stroke, unstable angina, or coronary revasc. The key secondary endpoint was the harder triple composite of CV death, MI, or stroke. Diabetics constituted about 40% of the population of the trial. Yeah, so we had pre-specified to look at the LDL reduction and the clinical event reduction in patients with and without diabetes to see if there was heterogeneity either in the relative risk reduction or the absolute risk reduction. And then in terms of safety, we looked at the risk of new onset diabetes in patients without diabetes at baseline, as well as looking at glycemic parameters, hemoglobin A1C, and fasting plasma glucose, both in patients with and without diabetes. Several key findings. First, indeed, even in a modern trial, patients with diabetes are at significantly increased risk of cardiovascular events, about a 25 to 40% increased risk even after adjusting for other differences in baseline characteristics. Secondly, the effect of evolocumab was consistent in terms of the relative risk reduction in both the primary and key secondary endpoint, both in patients with and without diabetes, about a 15 to 20% reduction. But given that patients with diabetes were at an increased baseline risk, the absolute risk reduction enjoyed in that group tended to be larger. And so that larger absolute risk reduction translates into a more favorable number needed to treat and therefore a more favorable cost effectiveness outlook for those patients. In terms of safety, there were no differences in safety whether the patients did or did not have diabetes. There was no increased risk of new onset diabetes in patients without diabetes. And importantly, we looked at the subgroup of patients who had prediabetes. That's a subgroup that in prior trials of statins appeared to be the at-risk subgroup. Even in that subgroup, we saw no increased risk of diabetes, a hazard ratio of 1.0. And then in terms of glycemic parameters, both hemoglobin A1C and fasting plasma glucose levels were virtually superimposable in the diabetics, patients without diabetes, even the patients with prediabetes. So very reassuring news. Well, I think that the benefit for PCSK9 inhibition, at least with evolocumab, is quite clear in patients with atherosclerotic cardiovascular disease. And now we've showed that there's consistent benefit regardless of whether the patient has diabetes or not. And given their higher baseline risk, patients with diabetes tend to enjoy an even greater absolute risk reduction. But it does raise the issue, what about patients with diabetes who don't have cardiovascular disease yet? We know they're at very high risk. This, I think, would be a logical next group to look at in terms of a high-risk primary prevention group to study intensive lipid lowering. So I hope that'll be the next frontier to examine that.